This is a special coronavirus update from Wink News.
Good evening and welcome to a special edition of Wink News at 7.
We're dedicating this half hour to answering your questions about coronavirus. And to do that, we have three experts with us tonight. NCH Vice Chair of Medicine, Dr. Carlos Quintero, NCH Chief Nursing Officer, John Kling, and financial expert Stefan Contorno, Senior Vice President of Touchstone Wealth Partners. Thank you all for being with us tonight. Dr. Quintero and John, special thanks to you and your colleagues for all of your hard work as we all try and get through this together.
And Wink News anchor Chris Safadi is with us in the Live Center.
We're streaming this special live on the Wink News Facebook page right now, so I'm going to monitor the feed. We have more than 100 comments already. I'll be looking for your questions over the next half hour, so send them in. We'll get them answered in real time.
Well, in the last half hour, we received an update from the Florida Department of Health on cases in our state. Now, here's where we stand tonight. There are 1,977 cases in our state. That's 300 more than just the 11 o'clock update this morning. There's also an additional death since then, bringing our state total to 23. 3 of those are in Lee County. Also new, Collier County now has 57 cases, up 10 since this morning. Lee County has 52 cases, also up 10. Charlotte County has 3 cases. DeSoto now has 4 cases. That is up from 1. So, Dr. Quintero, can we start with you? The Collier Medical Society is now calling on Governor DeSantis to issue a shelter-in-place order. Do you believe a step like that is needed, and why?
Well, at this point, I am going to really trust on our governor and his team to make the best decision possible to make sure that the population of Florida is safe. I know that here at Naples Community Hospital, we're working arduously to make sure that our community here is safe. So I'm really going to let our government officials do what they do best.
All right. Thank you very much for that. Do you have any other recommendations that you would like to make to people as they're watching you here tonight?
Well, we know we're going to see a rise in the number of cases. That's to be expected. We're going to be testing more patients. I think it's important that the population of Southwest Florida understands that this is a serious disease, but at the same time, people do recover. People do well. We know that the vast majority of patients will recover. The vast majority of patients are not hospitalized. And we've even had 7 total patients from our own facility that have recovered and are at home recovering from this disease. So there is hope. It's important that everybody follow the CDC guidelines, follow the recommendations from our government officials. And otherwise, here in Naples Community Hospital, we're here to help anybody who comes to us who is ill.
Okay, John, to you now. Lee Health says they're asking medical staff to use protective equipment differently than they were using it 2 weeks ago. So what's the status of that kind of equipment? For our viewers, we're talking about the gowns, the masks, the gloves. What's the status of all of that at NCH right now?
Our current status is very good. We have ample amounts of supplies to personal protective equipment supplies to care for our patients, to protect our staff. We, as Lee Health is doing, are following the CDC and Department of Health guidelines and recommendations to preserve PPE and use it when it's most clinically appropriate. So we're in a good spot for our staff and for our patients.
We know that NCH stopped mobile testing yesterday because supplies ran out. What does your test kit supply look like tonight? When might that mobile testing come back online?
So we were able to procure some more supplies today for delivery for next week. So our plan is to restart the mobile testing on Monday. So as we stated before, it's a day-by-day process for supplies. Our whole focus is that we want to make sure we have enough supplies to take care of our patients who are acutely ill in our healthcare system at both of our campuses and our physician offices. So that's our focus.
Dr. Quintero, a viewer named Pablo sent us a question. He said, I have been coughing for a few days, but it's only my allergies. Should I still get tested for COVID-19?
At this point, patients that are at home, they are having mild symptoms, respiratory symptoms, allergy-like symptoms, they should not panic and go get tested. They definitely do not need to come to the emergency room at any hospital. If they have any questions about their symptoms that they may be having or concerns they may be having, especially if they're mild symptoms, they should reach out to their primary care provider. And most primary care providers now in the community are able to provide telehealth services where a physician and a patient can chat online. So that would be a great opportunity perhaps for that patient or for Pablo to discuss his care with his physician. But with those symptoms, I really would not be that concerned. Symptoms perhaps that other people may be thinking about, or the most common symptoms that we would see with the COVID-19 patients would be fevers, usually up to 101, 102 degrees, coughing, and shortness of breath. Those are the most common symptoms that we're seeing now in our hospitalized patients. But we're also seeing a lot of patients that come in with coughing, allergy-like symptoms, and those patients may just be having seasonal allergies.
Okay, thank you, Dr. John. We have a video question from Cheryl in Port Charlotte.
What are we going to do when thousands of people cannot be tested for the coronavirus because they show no symptoms, yet they go out in public and unknowingly infect thousands and thousands more?
So, I've heard that question a lot in the past several weeks. And really what we should really do is heed the CDC and the Department of Health recommendations to social distance. We know that some carriers can be asymptomatic. So if we just follow the guidelines, good hand hygiene, social distancing, and for this time period, we should be okay. Follow the guidelines, let fear, not facts, rule our decisions.
All right, thank you very much. Dr. Quintero, we learned from Charlotte County today that doctors have cleared 2 of 3 coronavirus patients. So that leads to a question from Valerie, who lives in Cape Coral. She says, if you get coronavirus once, can you get it again, or are you then immune to it?
That is a very good question. I'm hearing that question a lot. I've been trying to read up on that as well. As far as we know, there seems to be low likelihood that you can get reinfected. But at the same time, I'm not too sure, or actually should I say, we should allow the research experts to do some more research on that to find out if, in fact, patients can get reinfected. So that's what I would tell that person for the time being.
Okay, very interesting. Dr. Quintero, we're about a week and a half into the social distancing. A lot of our viewers, they're working from home. They're trying to stay 6 feet away from other people, all in an effort to flatten the curve. Do you see evidence that we are making progress flattening the curve? Okay. All right, I want to make sure you can hear me. Dr. Quintero, can you hear me now?
I can hear you now, yes. Sorry
okay,
about that.
so that's okay. We were talking about the social distancing that we've been doing for a week and a half now. Are you seeing progress in that flattening the curve? We've heard so much about that. Are you seeing evidence that it's working?
It's hard for me to tell you about that right now. I think that the most important thing to do right now is to continue to social distance. I think our epidemiologists and our government officials will assist with trying to make sure that we're trying to do the right thing for the community, for our patients. We know that here we're really more interested in or actually very, very interested in taking care of our community and our patients that are coming to see us. So the flattening of the line, I think we're going to have to give that a little bit of time. Flattening of the curve, excuse me.
All right, thank you very much. We're going to switch gears a little bit here. A lot of people are having a hard time making ends meet right now. So, Stefan Conterno, we're going to go to you. First, late today, the Senate hit a snag in its effort to pass a stimulus bill. A lot of people are anxiously waiting for that approval. So we talked to a Cape Coral mother, Bethany Bauer, about what it means for her family today. Can you listen to this?
What will that mean for us? Well, basically a month of expenses. Like any reasonable and responsible American, we've been, doing our best to kind of keep ourselves with some sort of financial stability anyway.
So, Stefan, is this stimulus enough to turn things around, or what else might have to happen here?
Well, I think that's a great question. I mean, right now, there is no doubt about it. We're seeing an unimaginable amount of stimulus that's occurring. And in our view, really three things need to take place before we believe that the economy will begin to stabilize. The first is we need to see very aggressive monetary policy, and this is certainly stemmed by the Federal Reserve. We have been seeing that. The Federal Reserve has lowered rates to near zero. They've been buying back mortgage-backed securities. They have been buying back commercial paper, and they have basically given a blank check in order to make sure that we sustain our economy. So the Fed has been extremely aggressive on the monetary side. The second thing we need to see for stabilization is on the fiscal side, and that's what we're going through right now when we're watching our lawmakers basically try to come up with a stimulus package. It's estimated this package will be roughly around $2 trillion, although a lot of people think it may end up costing a lot more than that. And the third aspect that we need to see is we need to see the coronavirus and the spreading of it begin to diminish. As you mentioned, the curves start to slow down a little bit. Once we see all three occur, we believe we will see some stabilization in the economy, and then investors should feel a little bit more relieved.
Stefan, we have so many people who are on Social Security. Would our viewers who are on Social Security receive a check?
Well, it's a great question. I think the answer right now is we don't know 100%, but if you basically look at the bill right now and the draft of the bill, it does appear that anyone receiving Social Security would be entitled to receive those checks. Now, there are certain caveats with the bill as well that we have to keep in mind, and there are income restrictions. So for any individual that earns under $75,000, they would qualify, and for couples, they would need to earn under $150,000. So as long as that criteria is met, and it would be really justified by the modified adjusted gross income, if that is met, then they should be entitled to receive a check.
All right. Thank you, Stefan. Well, we have also received questions about vaccine research and how the current state of the economy relates to 2008.
So we ask our experts next on this Wink News special, your coronavirus questions answered. Welcome back to our Wink News special, your coronavirus questions answered.
Wink News anchor Chris Safadi has been following your questions online, so let's go to Chris.
Yeah, we're getting a lot of things in here in the live center in real time, and a lot of them, Dr. Quintero, are very practical questions that sound like somebody's taking care of somebody sick, and they're worried about how long this virus can last on things like laundry. Can I pick the laundry up a few days later and carry it across the house? Do I literally have to wash my hands every time I touch fabric or a piece of clothing that somebody sick might have touched?
So there's a lot of research that's still going on regarding on the virus, how long it lasts on certain materials, on the skin, on metals, on cloth. At this point, from what we've been able to decipher about this virus, it looks like it's a matter of hours to days, but it's not really 100% clear. What we need to continue to do is washing our hands as much as possible, following all the CDC guidelines that are out there for our community.
Dr. Quintero, we've heard very little about recoveries in Florida, but we know there have been 0 deaths in Collier County. So does that mean all the other confirmed patients are still battling the virus? What's the recovery rate?
So we have, at this point, 4 patients that are still hospitalized at Naples Community Hospital, and we have 7 patients that have been discharged both from the emergency room and from the hospital. This is a very small number of patients, so we're still looking and learning from an epidemiological standpoint as to the rates of recovery. But we do know that from other parts of the world that most patients recover just fine. We know that 80 to 90% of the patients may be very, very mildly symptomatic or asymptomatic at all. So there is hope. Patients do get better. And as I said before, here at Naples Community Hospital, we're here ready to take care of sick patients that come. We're going to do everything we can to take care of them and get them home.
Okay, those numbers are comforting. Thank you. Let's turn back to NCH's Chief Nursing Officer, John Kling. What is the plan for hospitals if you run out of room? Have you looked at secondary locations like transitioning facilities like our schools to handle more patients if you run out of beds?
Yes, and before I answer that question, I like to fix an error that I said earlier. I said let fear, not facts, rule it. It's facts, not fear, so I apologize for that for our live TV audience. To answer your question, we have very fortunate to live and work in Collier County. We have many organizations, our local schools, our Collier County Public Schools, large hotel chains that have volunteered the use of their facilities. We also have plans, if necessary, to do modular buildings, kind of like a MASH type of unit if necessary. Those are all worst case scenarios, but our pandemic surge plan is well prepared, and we're ready to enact if necessary.
Dr. Quintero, we want to go back to you with a question from a viewer named Rhonda. She said, coronavirus is not new. Why wasn't a vaccine developed when it was first found and then kept in CDC storehouse for future use?
So we know that coronavirus, there's different strands of the coronavirus, and this is a new type of strand of coronavirus. So this type of coronavirus is a new type of coronavirus. It's not something that necessarily we could have been prepared for. We've known that other coronaviruses have been around for many, many, many years. So just to clarify, this is a different strain of the coronavirus. It's not the same strains that we've had in the past. This is a completely different strain.
Okay, thank you. We want to turn back to the economic impact. Stefan, do you think the market and the economy is different than what people faced in 2008? And long term, we're curious, what do you think the impact of it will be on our area here in Southwest Florida?
Well, having lived and worked during 2008, I certainly have the battle scars to some degree to prove it during the economic recession. I think there are definitely differences between the two. In 2008, it was more of a credit crisis involving banks and involving mortgages, where this is different. This is more of a health issue that has led to a decline in our economy. The difference here as well is that the decline that we've seen has actually been very quick. It's only been a matter of several weeks. And it's our belief that we may very well get out of this almost as quickly as we got in. So it is our view that we're probably going to see more of a U-shaped recovery. But I think investors should feel at ease knowing that the Federal Reserve and the government is willing to do whatever it takes. They've already put in almost $6 trillion worth of stimulus that they're formulating, and it's probably going to be more than that. So I think it is very different when you look at the two. But I will tell you this. I think in about 20 plus years of doing this, I think there is a generational opportunity when it comes to investing here. I think for those who are willing to be patient and for those who are willing to invest for the long term, they can invest in certain companies right now that over the next several years, they will be very happy that they did that. Now, we can't quantify the success in days, weeks, or months, but more in years.
Okay, thank you, Stefan. And Dr. Quintero, this is a really stressful time for all of us, especially for our medical professionals who are on the front lines day in and day out. How are you and your team coping through all of this?
So it's actually been remarkable to see the support that we've had from the entire staff in the hospital, all the way from the administrators all the way down to everybody that's working with the patients. Not really surprising, but everybody has really stepped up to the plate. People are offering to take care of our patients. We're setting up units where we only have COVID patients or patients that are being ruled out for COVID. And there's been a huge amount of staff that are willing to assist with these patients. Same thing with our physician colleagues. I've had colleagues that have called me offering to come back to the hospital if they need our help. So we're ready. There's obviously a little bit of unknown factor, but it's been tremendous, and I feel actually honored to be part of such a great group of staff members here at Naples Community Hospital that have really stepped up to the plate to help our community.
Well, Doctor, our hats off to you. We want to thank our healthcare workers, all of the doctors and nurses, all of the staff, and we want to thank our panel of experts for taking the time to join us tonight, answer those questions. NCH Chair of Medicine, Dr. Carlos Quintero, NCH Chief Nursing Officer John Kling, and financial expert Stefan Contorno of Touchstone Wealth Partners.
Yeah, they all did a wonderful job for us. Thank you to all of them. We all know that you still have a lot of questions, and we hope to answer more as we go through this together. Keep sending us your questions to factsnotfear@winknews.com.
Now we want to check in with the Wink News Weather Authority.
All right, we'll take a look. We have a nice sunset setting up there, even over downtown Fort Myers. Temperatures still in the 80s for some of us. Others, we are already seeing the 70s throughout the area. So look at that. Cape Coral, 79 degrees. The rest of this evening, temperatures do stay in the 70s. And we should see some haze developing as we go into the overnight hours. So by the time you wake up going into your Thursday morning, just prepare for that if you're going to be up and about early. And then upper 80s by the afternoon. But record heat does return to Southwest Florida Saturday, Sunday, Monday. Still looking like the upper 80s in the forecast, but a week from today, we finally have some rain back here for Southwest Florida to look forward to late Wednesday night into early Thursday morning.
Thank you for joining us for the special edition of Wink News. Inside Edition is next.
Our next newscast is at 10 when you make the switch to WXCW. We're back here for Wink News at 11. See you then.